What if you could pop a pill that made you smarter? It sounds like a Hollywood movie plot, but people have been searching for ways to boost their brain power, perhaps for all of history. In the past century, scientific efforts have revealed a few promising chemicals, including the following. Caffeine. It's one of the oldest and most popular stimulants. People recognized caffeine's stimulant properties hundreds, perhaps thousands of years ago. It can enhance alertness and attention. However, the effects are short-lived and tolerance builds up quickly. Nicotine. It's also a stimulant. It's been used for hundreds of years for a range of medicinal purposes. It is very addictive and it has many dangerous side effects. Amphetamine, such as Benzedrine or Adderall. First synthesized in 1887, Benzedrine was the first drug to treat hyperactivity in children. Amphetamine can enhance attention and memory by increasing levels of norepinephrine and dopamine in the brain. But the compound can be addictive, and it comes with a range of side effects, including appetite loss, disturbed sleep, and even psychosis. Methylphenidate, or Ritalin, first marketed in 1954 and prescribed in the 1960s for treating hyperactivity. It became popular for attention deficit hyperactivity disorder, or ADHD, in the 1990s. As with amphetamine, it can improve memory and focus for those with ADHD, but it is also used off-label as a study and work aid. Some people build up a tolerance to Ritalin over time. Acetylcholine esterase inhibitor, or Aricept. Approved to treat Alzheimer's disease in the 1990s, it has been shown in sub-studies to enhance memory and attention in healthy people. More recently, researchers have found that a drug called modafinil boosts higher-order cognitive function without causing serious side effects. One recent review of 19 placebo-controlled trials found that the drug had a small but reliable effect on cognition. Modafinil has been prescribed in the U.S. since 1998 to treat sleep-related conditions such as narcolepsy and sleep apnea, and it heightens alertness much as caffeine does. Another review found that the methods used to evaluate modafinil affected the outcomes. So research that looked at the drug's effects on the performance of simple tasks, such as pressing a particular button after seeing a certain color, did not detect many benefits. Yet studies that asked participants to do complex and difficult tasks after taking modafinil or a placebo found that those who took the drug were more accurate, which suggests that it may affect higher cognitive functions, mainly executive functions, but also attention and learning, explains study co-author Ruade Battleday, now a medical doctor and PhD student at the University of California, Berkeley. Trials have not yet been done on modafinil's long-term effectiveness or safety. Studies of the drug have been carried out in a controlled scientific environment and usually only looked at the effects of a single dose, explains neuropsychologist and review co-author Anna Catherine Brem, then at Oxford. So no one yet knows whether it is safe for long-term use in healthy people. Nor is it known whether modafinil might lose its edge with repeated use, which is a phenomenon familiar to many coffee drinkers. Side effects are another important consideration. Modafinil has been shown to cause insomnia, headache, and stomach ache in some users, and some research suggests that it could be addictive. Although these kinds of problems may be worth enduring for a drug that treats an illness, if you don't have a medical condition, the risks versus benefits change dramatically, says Sharon Morin-Zamir, a psychologist at the University of Cambridge, who studies ethical considerations associated with the use of cognition-enhancing drugs. For some, the benefits will likely outweigh risks, at least some of the time, she says. Whereas for others, this may not be the case. A pill you take to ace an exam, for instance, won't do you much good if it also causes a grueling stomach ache. And when it comes to children and teens, cognition-enhancing drugs could present unique risks to the developing brain. Several clinical trials found modafinil to be safe when given to children with ADHD, But the trials lasted only a few months, making it difficult to ascertain the potential effects of long-term use. In a 2014 article examining the biochemical effects of modafinil and other common smart drugs, researchers at the University of Delaware and Drexel University raised concerns that the use of these drugs could affect the developing brain's ability to adapt to new situations and might increase the risk for addictive behaviors. Some engineers and hobbyists have turned to a different kind of potential brain booster, a jury-rigged electric technology that purportedly enhances brain function. This form of attempted brain hacking, known as transcranial direct current stimulation, or TDCS, is not as far-fetched as it might sound. The brain runs on electricity. Brain cells build up charges that impel chemical signals across synapses, the tiny gaps between neurons. When we learn something, the synapses involved become conditioned to fire more readily, and TDCS supposedly enhances that process. The tiny electric currents TDCS uses, which are generally 1 to 2 milliamps, cannot actually trigger the chemical impulse that crosses a synapse, but some researchers believe TDCS strengthens synaptic connections to make learning more efficient. Small laboratory studies suggest it can improve vigilance and reaction times. You get more bang for your buck by combining TDCS with conventional training, contends Maram Bixen, a professor of biomedical engineering at the City College of New York. The dawn of the non-invasive brain stimulation movement is widely attributed to a 2000 paper by German neurophysiologists Michael Nitsche and Walter Paulus. In a small study of healthy 20-somethings, the scientists showed they could make neurons more or less excitable by sending weak electric currents through the brain's motor cortex. The effects lingered minutes after stimulation. Previously, TDCS had only been studied in animals. A subsequent study in 2003 showed that such stimulation could improve a cognitive ability psychologists call motor sequence learning, the process of training to perform a series of precise steps. Several labs at Harvard Medical School and the National Institutes of Health picked up on these findings and conducted research suggesting TDCS had a potential for stroke rehabilitation and chronic pain. Brett Wingeier began watching the field in 2006. He was the principal biomedical engineer at NeuroPace, a Silicon Valley company that manufactures brain implants intended to help control epilepsy. He had also worked on brain stimulators for alleviating cluster headaches and some symptoms of Parkinson's disease. Some patients can be incapacitated, but you turn the stimulator on and it all goes away. It's amazing, Wingeier says. Yet he notes that those devices are only relevant to patients with relatively severe disorders. They're surgical implants. Wingeier dreamed of using neurotechnology to help more patients and maybe even healthy people. He was excited to see new TDCS studies, but many were done with yellow sponges and measuring tape and straps on your head, he says. The time seemed ripe to consider bringing product design principles into what he calls a legitimate consumer product people can pull out of the box and use. More plans began taking shape as scientists fleshed out possible mechanisms for how TDCS works. In a set of electrophysiology experiments published in 2009, Bixen and some of his colleagues demonstrated that a mild electric field can synchronize activity in a neural network. Such insights inspired Wingeier and other researchers working to target TDCS to specific brain areas. Some studies suggest brain stimulation might help people with neuropathic pain, as well as depression, schizophrenia, or people recovering from a stroke. For now, TDCS remains investigational for medical uses in the US, although in Europe, such devices are approved for treating pain and depression. More than 600 TDCS studies are listed in the clinicaltrials.gov database that tracks ongoing trials for drug therapies or medical devices. In addition, a growing number of studies are testing TDCS in healthy people, and suggest it can improve working memory, attention, and decision-making, as well as stimulate creativity. A 2012 study funded by the U.S. Department of Defense indicated TDCS may heighten vigilance, making people faster at spotting bombs, snipers, and other threats in fuzzy images. 4 other labs have since shown the technology could enhance learning. One of the few TDCS effects that's been replicated across institutions, says Vincent Clark, a cognitive neuroscientist who directs the Psychological Clinical Neuroscience Center at the University of New Mexico. The academic literature on TDCS has spurred a wave of media articles claiming that jolts to the brain can improve memory, boost math skills, and bring out the genius in you. An article in the Journal of Medical Ethics calls TDCS the Swiss Army knife of human neuroscience. As word of TDCS's potential reaches the general public, home users have been convening in cyberspace. In 2011, TDCS users created a Reddit forum and launched a blog the following year. Thousands of home users visit these websites to discuss scientific papers, post how-to videos, and ask questions such as where to place electrodes and how long to stimulate. In 2013, the first consumer TDCS wearable, a headset for gamers, appeared on the market. Since then, more than a dozen companies have started selling TDCS products. Most consumer TDCS devices are not marketed for clinical purposes, but for leisure and cognitive enhancement. None of the consumer kits have officially undergone the rigorous testing process that a drug or medical device must undergo for approval by the Food and Drug Administration. And the purchaser has only the manufacturer's claim that it works for its intended use. And intended uses can be ambiguous. For example, when companies assert their TDCS device increases concentration or amps up brain function, it is hard to determine if such instruments fall under the FDA's purview, says Anna Wexler, a postdoctoral student at the University of Pennsylvania, who studies the ethical, legal, and social implications of neurotechnology. The agency defines a medical device as an instrument that is intended to affect the structure or any function of the body, she says. The way a manufacturer markets the product determines the regulatory pathway, adds Wexler, who explored some of these issues in a 2015 paper in Journal of Medical Ethics. Enhancement claims have aroused suspicion among scientists, prompting more controlled lab studies. In one experiment, published in 2016, a team from the Netherlands reported that a commercial TDCS headset actually made participants less accurate in a well-established test of working memory. A major problem with assessing how well the technology works is that the vast majority of research studies use brain stimulation for different purposes than do home TDCS users. Contrast home usage with the 2000 paper authored by Nietzsche and his colleagues that tested whether non-invasive brain stimulation could help people recover movement after a stroke. We just wanted to know if we could change motor performance, Nietzsche says. Our question was not, does the stimulation protocol induce maximal performance? Home TDCS users, on the other hand, are not particularly interested in making new scientific discoveries, Wexler says. They're interested in self-improvement. This quest for enhancement could potentially lead to untoward consequences. In 2016, clinicians and scientists who study TDCS published an Annals of Neurology editorial warning of potential undesired effects. For example, stimulating one brain area might help someone learn new material, but hurt the ability to process learned material. Changes in brain activity might last longer than users expect, or may extend beyond the regions underneath the electrodes. Also, the effects of TDCS vary tremendously across individuals and with small changes in the process. When it comes to placing electrodes, even just a few centimeters can be enough to change the effect, Clark says. How long you stimulate, how much current you put in, if it's 2 or 1 milliamp or something in between, all of that matters. Genetics, age, and skull thickness also seem to influence the response. The technical specifications for medical uses have yet to be clearly delineated, let alone the parameters for cognitive enhancement. In addition to applying direct current to the scalp, brain hacking researchers and DIYers are experimenting with other methods, including alternating current and random noise stimulation. These might one day complement more established non-invasive medical technologies, such as magnetic stimulation and ultrasound, to influence brain function and behavior. Transcranial direct current stimulation, Clark says, is just the tip of the iceberg. Leaving aside methods of artificial stimulation, cases of so-called accidental genius have proved intriguing to researchers. A 10-year-old boy, Orlando Serrell, knocked unconscious one day by a baseball, discovered afterward that he could bring to mind the exact day of the week for any date after the accident and could remember the weather for each day since the trauma as well. He could also recall the most minute daily events. Jason Padgett, the victim of a brutal mugging in 2002 that left him with a severe concussion, soon afterward began to see what he described simply as images. He began to sketch them out on paper. When he showed his work to others, he learned that the repeating, self-similar patterns were fractals. These two people have a remarkable condition known as acquired savant syndrome. In the more familiar form of savantism, made famous by the 1988 movie Rain Man, people are endowed from early in life with extraordinary but narrowly defined musical, artistic, mathematical, memory, and mechanical skills that stand in contrast to impairments in language, social interactions, and other mental faculties. In Rain Man, for instance, actor Dustin Hoffman's character, Raymond Babbitt, has stunning mathematical, calendar calculating, and other skills, and a massive memory, but also shows severe cognitive and behavioral limitations. In acquired savant syndrome, in contrast, extreme artistic or intellectual skills show up after dementia, a severe blow to the head, or another insult to the brain. Discovery of this unusual phenomenon raises the possibility that dormant potential in some artistic or intellectual realm, an inner savant, resides in each of us. If so, perhaps a way can be found to tap these buried abilities in the absence of disease or injury. Darold A. Treffert compiled a worldwide registry of known savants. As of 2018, there are 91 recorded cases of acquired savantism. What sparked Treffert's interest in the acquired variety was attending the premiere exhibition of exceptional sculptures made by Alonzo Clemens. As an infant, Clemens seemed to learn quickly. At about age 3, however, a fall resulted in a brain injury, slowing his cognitive development precipitously and leaving him with serious intellectual disability, including limited vocabulary and speech. But afterward, he developed a spectacular skill for sculpting, using whatever materials were handy, even shortening from the kitchen. With his new talent came a growing fascination with animals. For example, he could look at a photograph of a horse in a magazine and then sculpt a three-dimensional replica in less than half an hour, each muscle and tendon reproduced in exacting detail. In 1923, psychologist Blanche M. Minogue described the appearance of extraordinary musical abilities in a 3-year-old following a bout of meningitis. In 1980, T.L. Brink, another psychologist, reported on a 9-year-old boy in whom superior mechanical skills appeared after a bullet wound to his left brain. In his case, he was able to dismantle, reassemble, and modify multi-gear bicycles and invented a punching bag that could simulate the bobbing and weaving of a live opponent. These sparse reports in the years before 1980 reflected the condition's rarity. A concussion or stroke does not usually enhance cognitive or creative capacity. Among the reports entered in Treffert's registry was work done by neurologist Bruce Miller, now at the University of California, San Francisco, and his colleagues. In 1996, Miller began compiling cases of people who had a disorder known as frontotemporal dementia, or FTD, and who demonstrated musical or artistic skills for the first time after their diagnosis. Frontotemporal dementia differs from Alzheimer's dementia in that the degenerative process affects only the frontal lobes and not wider areas of the brain. FTD often targets the left anterior temporal area of the brain and the orbitofrontal cortex. Both regions normally inhibit activity in the visual system at the back of the brain, which is involved in processing incoming signals from the eyes. The disease seems to foster a newfound artistic sensibility by turning off inhibitory signals from the front of the brain. The releasing of the brakes allows the brain to process sight and sound in new ways. It unleashes artistic or other creative sensibilities, even though damage to the frontal lobes may lead to inappropriate behaviors that characterize the disorder. FTD is an unexpected window into the artistic process, Miller says. Further work implies that accidental genius results from diminished activity in some brain areas that is combined with a counterbalancing intensification in others. More specifically, it involves a set of events that Treffert calls the 3 R's that occur after the brain is damaged. Most often after the left hemisphere is stricken, similar to what happened with Miller's FTD cases. The process begins with recruitment, a rise in electrical activity in the still intact cortical tissue, often in the right hemisphere. Then the brain circuitry undergoes rewiring to establish newly formed connections between regions that were not previously linked. Next comes release of dormant capacity as a result of increased access to the newly connected brain areas. An experiment done by Richard Chi and Alan Snyder, both then at the Center for the Mind at the University of Sydney, has used a relatively new technology to provide some evidence that these brain changes account for the acquired savant skills. Using transcranial direct current stimulation, TDCS, these researchers induced savant-like abilities in human volunteers. The technique generates a polarized electrical current to diminish activity in part of the left hemisphere involved with sensory input, memory, language, and other brain processes, while increasing activity in the right hemisphere, specifically the right anterior temporal lobe. The investigators then asked study participants to solve a challenging 9-dot puzzle, either with or without TDCS, a task that requires the creativity to search for a solution in an unconventional way. Participants had to connect 3 rows of 3 dots using 4 straight lines without lifting a pen or retracing lines. None of them could solve it before stimulation, and when 29 subjects were exposed to sham stimulation, so electrodes were placed on the scalp without any current to test for placebo effects, they were still at a loss. With the current switched on, however, about 40%, 14 of 33 participants, worked their way through the puzzle successfully. How can a person suddenly perform so much better at the flip of a switch? Because these instant savants, and congenital and acquired savants as well, know things they were never taught. Clemens, the sculptor, had no formal training in art, but he knew instinctively how to produce an armature, the frame for the sculpture, to enable his pieces to show horses in motion. One plausible explanation for the hidden talents that emerge in savant syndrome, whether early in life or induced by injury, is that these reservoirs of skill and knowledge must be inherited in some way. We do not start life with a blank slate that subsequently gets inscribed through education and other life experiences. The brain may come loaded with a set of innate predispositions for processing what it sees or for understanding the rules of music, art, or mathematics. Savants can tap into that inherited knowledge far better than the average person can. Knowing that these talents can emerge even later in life raises the question of whether everyone has the capacity to become a savant, and whether it might be possible to do so without facing the travails of brain injury or dementia. Another way to unleash buried brilliance would be to apply TDCS, or a related technology called repetitive transcranial magnetic stimulation, as a form of thinking cap that would toggle brain regions on and off to potentially augment a person's creative capacity. When a coil placed over the left temple delivers a pulsed magnetic field through the skull, the field apparently turns off brain circuits in the left temporal area that process words and other information. Right brain circuits dedicated to spatial tasks then take on a more expansive role in mental processing. In some cases, subjects exposed to the magnetic fields were better able to guess the quantity of a large collection of objects. A technological solution may not be an absolute prerequisite, however. Meditation or simple adherence to assiduous practice of an artistic skill may suffice to allow us to switch on the more creative aspects of the brain and thus explore undiscovered artistic capabilities. As investigators understand the brain better, they may find other ways of determining what happens when brain circuits are turned up or down. Diffusion tensor imaging, or DTI, and diffusion tensor tracking, or DTT, pinpoint connections among neurons, also called fiber tracking. They're better suited than earlier methods for revealing the intricacies of the wiring inside a person's head, enabling researchers to correlate brain activity to the sudden appearance of skills. These more precise technologies can provide three-dimensional images of the fibers that tie together brain cells. One challenge to uncovering the neurobiology underlying savantism has been the difficulty of observing brains as people carry out creative tasks that require movement. Not only is it hard to sculpt or play a piano inside an MRI machine, but any movement compromises the image clarity. But a newer technique, near-infrared spectroscopy, or NIRS, would sidestep such problems by replacing bulky machines with a comfortable skull cap that measures the amount of oxygen and blood flowing through the brain's blood vessels and relays the information to image processing software. Even more promising is a recently developed helmet that uses another imaging method called positron emission tomography, or PET, for monitoring when a person is sitting, standing, or even exercising. Such studies are worth pursuing. Acquired savantism provides strong evidence that a deep well of brain potential resides within us all. The challenge now is to find the best ways to tap into our inner savant while keeping the rest of our mental faculties intact.